Hello everyone, I'm Daisuke Sawamura from Department of Rehabilitation Sciences. Thank you very much for inviting me to this wonderful opportunity. Today, I would like to talk about my research contents related to cognitive neuroscience and rehabilitation. I hope this would meet interest of some of you. I would like to contribute to the interdisciplinary development of neurorehabilitation by utilizing my clinical experience as an occupational therapist and the knowledge, technique, and research experience I have gained in the health sciences and biomedical engineering. In addition, I would like to promote translational research based on a bi-directional reciprocal model between basic and clinical research, which is the core of my current research. I'm promoting translational research by considering how we can apply the findings of basic research to clinical practice and social implementation, and how we can derive more scientific answers to questions raised from clinical by incorporating them into basic research. We believe that this will allow us to promote translational research that contributes to solving problems such as super aging society and the lack of evidence for rehabilitation intervention. My fundamental knowledge of conducting translational research is based on the neuropsychology and the neuroimaging and the neurophysiology, in addition to practice sciences such as occupational therapy. In this symposium, I will introduce my research on two main topics. The first topic is neuroimaging and behavioral study based on the findings of basic research, which evaluated behavioral changes by neuropsychological tests and neuroplasticity evaluated by the structure and functional brain MRI, and the study that investigated the effect of non-invasive brain stimulation based on the result of that research. The second topic is study that investigated the effects and its underlying mechanisms of repetitive motor learning in the non-dominant left hand, and the neuromodulation study that examines the effect of non-invasive brain stimulation based on the findings of the study, which was based on the questions raised from clinical rehabilitation. As aforementioned, today's talk consisted of the two research topics: computerized cognitive training and motor skill learning in the non-dominant hand. Each topic commonly follows two contents: neuroimaging and neuromodulation. From here, I would like to introduce my research. First, I will introduce a study on the effect of computerized cognitive training, abbreviation CCT, using a structure and functional MRI. The way to evaluate training effect on cognitive function has been evaluated using MRI to assess brain structure and function, as well as the neuropsychological testing and daily life related activities and work conditions. Here, we report on the result for healthy subjects in which the scope of outcomes were brain function, brain structure, and even cognitive function. Previous neuroimaging study that employed diffusion imaging or functional MRI have reported that the short-term training modulates the brain microstructure and function. Nevertheless, the relationship of these brain changes to cognitive performance has very little been explored. In fact, we developed a CCT specialized for attention and working memory, and evaluated its effect on 67 healthy subjects by neuropsychological and brain MRI tests Training group underwent a 1-hour-long CCT 5 days a week for 4 weeks. In each group, neuropsychological test and MRI were performed twice before and after training at an interval of 4 to 6 weeks. Here, as a result of this study, 4 weeks CCT improves not only attention and working memory test, but also other cognitive domains, such as complex cognitive functions. Additionally, structural MRI, here is a DSI result, showed structural changes in the cerebrum and hippocampus and right parietal cortex. And the resting state function MRI showed increased functional connectivity between the right parietal cortex sheaths to left frontal regions. This is an overview of correlation matrix focusing on the correlation between test performance and the MRI index. The results show significant correlations between the parietal and complex cognitive performance here, and between right cerebellum and verbal memory performance. These results suggest that the training-derived cognitive improvement may improve the right inferior parietal cortex and the right cerebral vermis for provoking the transfer effect to other cognitive domains. Although research on the effectiveness of CCT for older people and the patient with moyamoya disease is also ongoing, I am considering the construction of a cloud-based remote health rehabilitation system, even if it is still in the conceptual stage. I hope to contribute to the cognitive maintenance and the improvement of patients with cognitive decline by setting up an environment in which CCT can be performed freely, anytime and anywhere in the club. Hokkaido University Hospital is a hub institution for support of patients with cognitive dysfunction. And I expect the possibility of using the system as a support system for subjects living in the countryside. This is a second study. This study is a neuromodulation study conducted to establish a more effective treatment based on the result of previous studies. The research question is, what effect does non-invasive brain stimulation have on working memory performance? Transcranial electrical stimulation, TES, is a non-invasive brain stimulation technique that modulates cortical excitability under the electrode and has been reported to improve cognitive and motor performance during and after stimulation. In recent years, evidence is accumulating and it has gradually become popular in the rehabilitation field. TES mainly comprises 3 different stimulation techniques. Right side figure shows. So TDCS is a golden standard technique, but more recently, TRNS has received scientific attention because of its less uncomfortable and its greater effectiveness. In this study, my group evaluated working memory performance using this stimuli. Our recent meta-analysis of TDCS in working memory confirms that the effect has a significant but small effect size. In 12 of the 18 studies included here, the left DLPFC was selected as the target brain region. The effect size ranged from 0.13 to 0.19. This is the flow diagram with the number of participants and demonstrating the procedural step to final data analysis. This trial enrolled 120 healthy right-handed adults, and they were randomly allocated to four types of simulation. This slide shows a schematic illustration. Upper figure A shows an overview of the experimental procedure. The experimental procedure consists of the three phases: pre-assessment phase, and the post-assessment phase. The dual endmark task was performed for 11.5 minutes. This is a working memory task each session, and the trans-electrical simulation was delivered for 21 minutes in the online session. Figure B shows the dual endmark task. The series of auditory and visual spatial stimuli are presented simultaneously. The participants were required to answer as quickly as possible whether the current stimulus was the same as the stimulus presented 2 times before. Figure C shows the electrode configuration and the 4 types of electrical current waveforms. The anode, red, indicates the anode. The anode and the cathode, blue, were respectively placed over the left DLBFC and the right orbitofrontal cortex, while TDCS delivers a direct electrical current with a consistent intensity. TRNS delivers an alternating current with random frequency and intensity. Here are the results of group performance in the dual endmark task. Left figure shows mean Z scores and standard errors in all groups. TRNS over the left DLBFC led to significant improvement in the accuracy and the D' score compared to the sham groups. In the online assessment, we can see the significance shown in the green highlighted part. The right side figure shows that TRNS had a significantly larger negative line slopes than the sham group. According to this result, TRNS generated greater benefits for healthy individuals with lower WM performance. According to this result, further study will be needed to continuous and repeated long-term follow-up to determine the durability and persistence of any observed improvements. Moreover, the physiological mechanisms of TRNS on the frontal lobe needs to be clarified by using some neuroimaging techniques. This is the third study of my group. This was conducted based on the questions and the needs that were raised from clinical practice regarding the training of stroke patients to exchange their dominant hand. The research question is, what effect does the repeated practice of the chopstick operation have on improving their skills? This is the first study in the world to clarify changes in the brain activity during a seated task in an environment closely linked with daily life. Focusing on 3 cortical regions related to motor learning, brain activity was measured after 3 weeks and 6 weeks. And it was confirmed that changes in brain activity patterns occurred with motor mastery. The left dorsal prefrontal cortex DLBFC, shown in the blue, was activated before training here, but gradually decreased with skill mastery, while the left prefrontal cortex increased with skill mastery. 3-indice joint smoothness, chopstick movement speed, and stress from chopstick use were used to evaluate the chopstick operation skill. 6 weeks of repeated practice in a laboratory environment confirmed that the left hand chopstick movement skill reached almost the same level as that of the right hand skill. However, only remains a stress indicator. Based on this result, we decided to conduct a study to further improve the efficiency of motor learning in the left dominant hand by focusing on the brain regions corresponding to the different motor learning stage. In order to focus on the early stage of motor learning, we decided to place TDCS anode on the DLPFC. The right side figure shows a simulation result of the actual TDCS stimulation, in which the intensity of the current increase in the center of the DLPFC. As I just mentioned, the fourth study is a TDCS study aimed to examine whether TDCS enhance early motor learning in the left dominant hand. The research question is, does TDCS to DLPFC enhance motor learning in the non-dominant left hand? Previous studies have reported that in motor learning, the higher the complexity of the task, the higher the activity of the left DLPFC. Although left hand dexterity is a challenging task, my group hypothesized that the benefit of TDCS may be even greater in chopstick and writing task, which further increase complexity. This is a flow diagram. The final sample comprised of 66 healthy young adults. Our results showed the neuromodulation to the left DLPFC enhanced early motor learning of the left hand, as hypothesized. Especially, the benefit was found to be more pronounced in complex assembly tasks than in single peg tasks. For future perspectives, it is necessary to verify the effectiveness of TDCS in repetitive sessions for clinical application. In particular, the target task should be chopstick and writing movement, which are typical dominant hand skill. After confirming safety and effectiveness in healthy subjects, I would like to link this to clinical research targeting stroke patients. In addition, it is necessary to elucidate the physiological effects of non-invasive brain stimulation in order to establish basic evidence. This study is a joint research with Hong Kong Polytechnic University, and we plan to confirm how brain network is modulated by non-invasive brain stimulation, and how brain metabolites are altered. For the future development of neurorehabilitation, I believe that seamless information sharing between researchers who develop new methods and clinicians is important. I believe that close communication with clinicians taking an interest of listening to each other's activities is essential for the development of neurorehabilitation. There are many mutual benefits lying this. I would like to take this after Corona as an opportunity to actively promote clinical research. I hope that today's opportunity will lead to the creation of some researches, the development of my neuroscience and neurorehabilitation research, the development of my future research partners, and furthermore. I would like to conclude my presentation by thanking all co-researchers. Thank you for listening.